our symposium today. And I just taken this title, Intervention, Innovation Never Stops, as it is a real fact. I'm just going through the history of intervention. I'm probably over cardiothoracic surgery, and just to show how people started, and it was very recent time when intervention started, and when we end up, and still every day we listen and hear about something different in intervention. And seems like it's going to be complex PCI. Just bear with us for. Yes. Sorry. So the journey of intervention, it started in the year 1929, and this was the first intervention, or first actually coronary angiography, or the idea of coronary angiography came, and that was by Dr. Wiener Forsman. You know, the jealousy in the medical field, it was there from that time. The first actually trial of angiography, whoever did it, actually he was stuck out of the medical practice. But later on, he was given a Nobel Prize. So in 1941, the concept of cardiac output was put in place. And 1953, the Selden technique, which we use it now in every procedure, was introduced. And in the year 1953, this was the first ever bypass surgery was done. So bypass surgery started before intervention. I can admit that to please my cardiothoracic colleagues. At that time, actually, things actually were very demanding, very complex. A lot of materials are used, and you can see the room. This is just for diagnostic angiography. You see the suffering of the patients at that time if you want to do coronary angiography. And in 1958, this was the first time actually this was selective coronary angiography. It happened by accident by Dr. Mason sons, who at that time it was complicated by VFRS as the catheter went to the right coronary artery. 1964, the daughter technique was also came to the horizon. And 1967, Ren Favaloro, he did the first SBG bypass angiography in Cleveland, in Ohio. 1967, there was commercialization of Judkin catheters by Dr. Judkin, who has the well-known Judkin catheters, which are still in use. This is Sons and the 11-inch image intensifier used for the first coronary angiography. You can see as if he's just going to the moon. And this is actually the scene frame of the first right coronary angiography, which was done by Mason and Son in October 30th, 1968. Here also the first actually graft angiography, which was done by Mason as well, just following his first coronary angiography. In 1973, gantries used the rotating U-arms, and in 1974, Adris Grinzik did the first balloon angioplasty. In 1997, Grinzik and Miller and Hanna, they did the first balloon angioplasty in San Francisco. In 1977, himself, he did also the first coronary angioplasty in a patient who was awake at that time in Zurich. And in 1978, Mellers and Stiezler did the first PTCA in the United States. And 1980, the guiding catheter were introduced into the intervention cardiology. In 1982, over-the-wire system and steerable guide wire was used, and in 1986, it was the first coronary angiography expanding wall stent by Jacques Ball and Altric Sigward in France. The IBOS was introduced quite recently, and in 1989, Palms Charts developed the first stent. In 1982, at that time I was just born, the first CAS and BCI from the radial approach by Dr. Frindal Kenimis, that is just decrease the complications of coronary angiography. I would rather actually say that actually this is one of the most important advancement in the area of intervention, which decrease the complication of coronary angiography to the degree that we can say coronary angiography and angioplasty is a very safe procedure nowadays. In 1994, BAMS Schwarz did the first perimeter stent, which was approved by the, in fact, actually the year of the approval, it was actually developed just maybe 1 year before that. In 2003, Cypher stent was FDA approved, and 2004, Texas stent was approved. Unfortunately, both these stents nowadays are out of the market because of the development in intervention and stents. In the year 1997, more than 1 million angioplasties worldwide were done. In 1999, 85% of the patients with PCI received stent. 2001, 2 million angioplasties worldwide. If anybody knows this gentleman, probably you know the one on the in his left side. This is actually Dr. or Mr. Clever. He did actually the first in humans TAVI, which is percutaneous valve. This was in the year 2002. The idea actually came from his other colleagues who did it in a big one of a cardiologist and his colleague who was an anesthetist. The decision Abigas was successful, and he's actually still working. I went to meet him in one of the meetings, and I spent a few days with him in their CAS lab. This was done in 57 years old gentleman, and who was having cardiogenic shock and left ventricular ejection fraction 12%, and it was a successful procedure. We all know now the TAVI is now commonly used worldwide, where you can go with from the femoral artery or other arteries, the femoral is not accessible, to deploy an stent. And this is started at the beginning for the high-risk patients, and now actually the guidelines are changing. And recently, the intermediate risk and also the probably the future is very promising for the low-risk patients as well. This is the kind of stents, and now actually there is a group of stents worldwide all approved by the FDA. And the technology is still developing, and actually the innovation is going day by day. And nowadays, even you can put valve in valve. This is regarding the aortic valve, but even things actually went to the other valve. Now we have the mitral valve. In fact, actually the BTMC or balloon mitral valvuloplasty was used our first in the year 1886, but later on actually he made his balloon, which was introduced into the for the interventional rheumatic heart mitral valve stenosis. Now actually there is a lot of structural procedures which are approved by the FDA, including the BTMC, as we know, ASD closure, BFO closure, PDA closure. It was balloon expandable aortic valve, mesothelioma self-expanding aortic valve. Also, the mitral clip, when you can actually decrease the mitral repair with a clip for high-risk patients as well. The Watchman left atrial appendage occluder was also introduced into practice many years back. Also, the Sanol septal ablation, VOSD occlusion, tricuspid clip. This is actually very recent now, the tricuspid clip and tricuspid valve implantation. And we know about the EB study. Now it is a separate subspecialty of cardiology, but again, it is a kind of intervention. So basically, as a Almana group, actually, we have been following this innovation day by day. In fact, actually, our CAS lab was the first CAS lab in the private sector in the region here. It was actually established by my colleague, Dr. Samir Abdullah. I hope he's here. He was invited. I will give him the privilege. Actually, he started, he was vascular surgeon, and he was also peripheral interventionalist, and he did actually peripheral intervention initially, and also my other colleague before I joined Almana in 2010, they started straightforward type 1 BCI. I started in 2010, and actually since that time, in the first year, we start a few months actually after starting, we started the pacemaker services, and this is actually now including the CRT and CRTD and CRT pacemakers. Also, ICD was introduced. Regarding also the intervention, we introduced actually the complex BCI, including main stem, CTO, including antegrade and retrograde. And actually, we started EB study a few years back, but regarding ablation, it was started quite recently by our colleague, Dr. Wafa. And in fact, actually, have been following the innovation, and we have been awarded. Actually, there was a competition for intervention, and we actually submitted 2 cases, and one of them was innovation, where there is a new technique in which actually the stent was moving forward and backward. It was very difficult. It was dancing. It was very difficult to deploy it in place, and actually we did it with the same wire. We did rapid pacing, and we managed to implant that stent in place. And actually, 500 cases were submitted. 3 cases actually were chosen, and ours was the one actually awarded as the first case. We are still following the innovation day by day, and in fact, actually, our colleague in the other group, Almana Dammam, Almana Al-Khobar, we actually started with Almana Dammam as 1 CAS lab. Now we have 4 CAS lab in Hafuf, in Jibel, and in Al-Khobar, and we have our CAS lab, 2 CAS lab in Dammam, and we are going to start service also in Al-Azizia, probably in the next year or so. So far, we are following the innovation, and whatever new, actually, we are the first actually to introduce the other the complementary services like the IFR, FFR, the OCT, and IVAS studies in the private sector I'm talking about. And we are still following the innovation, and if anything new, inshallah, will be actually up to date. Thank you very much for your time. Thanks.
Thank you, Dr. Abdullah, for your